Okay, I just want to do one sextant, the facial aspect of the maxillary right sextant, using the Gracie 11, 12, and 13, 14 together on consecutive teeth. I did paint some pencil on the line angles so that you can see that reference point that I'm talking about, and this would be for insertion and our angulation for insertion. I just want to talk about that for a second. You know, once we know that we have our correct working end in the Gracie 13, 14, you know, terminal shank is parallel to the tooth and the functional shank's up and over, we would typically always do a get ready zone, and then we would, because right now my face is 70 degrees to that tooth, in order to close it for insertion, we'd have to take the handle towards the tooth. So it looks like it's crossing the tooth for insertion, and that's definitely okay. I got the correct cutting edge to that tooth surface, and then I would be able to insert. Now when we get most posterior, that is really a difficult task to do, to go to the get ready zone and close for insertion. If you understand get ready zone, close for insertion, you can already reach back there in that position. Okay? Now what that means is that you're skipping those steps, but not really, because you're going to be able to start where you need to start. What we don't want to see when you're inserting with a Gracie 13, 14 is we don't want to see the handle coming towards the ears. Okay, we do see a lot of that. The other thing that's really inefficient to see is that when I see the whole lateral side of a working end to that distal, that's really hard to recover, to roll into that interproximal space. So remember, you always want that cutting edge. By the way, it is the inner cutting edge. You want that right at that line angle, and then you would just close, and then you could insert, and you can do your strokes and get halfway across the tooth approximately. Now I want to jump to the 11-12 for a second. On the 11-12, remember, we can use this on the buccal surface in the mesial and the lingual in the mesial. We talked about utilizing all three stroke directions: horizontal, oblique, and vertical. You would always start at the distal line angle, so you would place your instrument, your toe is at that distal line angle, but you'd pivot. Okay, and then you would take your working end, your handle, and you'd close it. So now that I can see a lot of the back, and I would insert that for, close that for insertion, and I can open it back up. In this position, I'm in a position to do a horizontal stroke. Now if you notice, I snuck behind that line angle mark. So this is where calculus is often missed. This is the best way to get calculus from a distal line angle, is to do a horizontal stroke sneaking behind that line angle mark. That I would then come out, readjust my handle, and I would reinsert at the line angle, and I'd be oblique. I might have to pivot up and go horizontal if there's the root trunk depression, but I'm kind of doing a combination of oblique, maybe horizontal. As I approach that mesial line angle, I need to start rolling and getting tall on my fulcrum to get that shank parallel. That's really important, because now I know I'm at that angulation. So do anticipate rolling and pivoting to get tall using the line angle. Well, since we're supposed to go from most posterior to anterior, and starting at the distals and doing those first, and then to the mesials, then our sequence would be is that we would pick up our 13, 14 first, and once again, you get to start right at that line angle, so we should see the handle coming out of the mouth. We should see the shank crossing that tooth a little bit. Then we know you're adapted properly, and then you could slide that subgingivally, and you would walk and get halfway across that tooth into that caul area right under the contact. Now you'd come out and go to the next tooth. Same sequence, same process. And if you do this starting right at the line angle, you don't have very far to walk, and you have your roll room where you need it, so you're able to roll. And then you'd pick up your Gracie 11, 12, and then once again you'd start at that line angle, pivot. Now you're in a horizontal position, and you would walk, and you would start anticipating that line angle, and then you would get tall. And once again you'd follow most posterior and go all the way to the anterior. Our little bicuspids are very narrow, so you might go up into a horizontal stroke. You might stay into a horizontal stroke to the next line angle, then you'll start to pivot and roll and get that shank parallel. Short biting stroke for calculus removal stroke. I want to show you guys, we talked about doing some finishing strokes, and people often have a thin layer, sometimes thick layer of plaque at that line angle going in approximately. And this is a great way for you to practice your finishing strokes. So they would be multi-directional. You see how I'm going oblique and I'm going vertical and I'm getting rid of that pencil. That's how you would deplaque a root surface or a tooth surface. And the pencil is going to really help guide you to telling me which way to pivot so I can erase all that pencil and get it off the tooth. And that's how you would deplaque a tooth. So those are your finishing strokes. Anytime you do a calculus removal stroke on a root, you'd especially go back and then you'd want to smooth it out, multi-direct. And then we do an assessment stroke to see if we're happy. So I just wanted to reiterate the sequence for these Gracie posterior curettes and where to start on the tooth and what you should be looking for insertion. Thank you.